Newborn. We're talking about newborn. I fact that show up on the NCLEX. You have to know newborn is part of the health promotion. Most people who I've heard from that did not do well, they did not do well under this section, health promotion. So let's get down and tackle this business. What is the next priority? This is what prioritization. And there's note the yellow thing to the skin of a 36-hour-old. So less than what? 2 days old, but more than 24 hours. Encourage breastfeeding every 2 to 3 hours. Notify the pediatrician for immediate phototherapy. Assess for bilirubin level. Document the finding as normal. What do you think if you see this NCLEX question? If you're taking the exams and you see this, what would you do? The key concept is yellowing thing. This is what? Hyperbilirubemia. This is jaundice. Then the concept you need is it 24 hours or after 24 hours? Before 24 hours is bad. After 24 hours is okay. But why is okay? You don't just ignore it. You got to do something about it. This is more than 24 hours. It's okay, but don't worry. But we got to do something about it. Breastfeeding the baby, you mean you want it to go away. You don't know the level. You want something less than 12, right? If it's very high, it's a problem. Notify the pediatrician for immediate phototherapy. Well, it's 2 days. So it's getting to 2 days. So that's not a major problem. But before you start phototherapy, you got to know how high is the bilirubin. Assess the bilirubin level. It look normal. If it's normal, we don't do anything. So I'm supposed to check it. Document the finding as normal process. Fine. It's a normal process, but you should not ignore it. Number 4 is the most common one people will pick. No. 2 is a trap, right? It's more than 24 hours, but at least you need to know. They may need phototherapy. You need to know the level. So assess for the level. This is much, much better. So join this in the first 24, 48 hours, maybe get bilirubin, but bilirubin level need to be assessed. That's the key. During a newborn assessment, the nurse observed a single crease buzzword across the palm of the infant. Know this information and please love it. It's a typical newborn abnormality that can lead to other questions. What do you think? This is normal finding? Let a pediatrician know about it. Perform a full neurological assessment. Encourage bonding and skin to the patient and parents. What do you think? Which one will you pick? I can tell you what is the right answer. What do you think is the right answer? This need a further workup because that's the right answer. It maybe indicate Down syndrome. One is no, A is wrong because that's not normal finding. The patient may need full neurological assessment, but not you. At the same time, Down syndrome doesn't need full neurological assessment. You should let the doctor know. Skin to skin, you basically ignoring the finding that single crease is okay. Therefore, this may indicate Down syndrome. We need a further workup, and that's the right answer. This may be hard, but it's not. If you pay attention to the buzzword, finding require immediate intervention, prioritization. That means all of them are okay, but one of them is number 1. And nurse is assessing a newborn 1 hour, just got born 1 hour, less than 6 hours. Which one should you worry about? That's all. Temperature 97.5, heart rate 125, respiratory rate of 72, and nasal flaring, bluish discoloration of the hands and feet. Stop the video. I would like to know what you pick for this. Put down in the comment section and let me know. Say, adapt in class. I pick this answer choice. 1 hour old. What do you think? Bluey discoloration of the hands and feet is an expected finding. That's acral cyanosis. That's not bad. But if there is a bluish discoloration on the torso, that's bad. But if it's on the extremities, that's okay. So this is okay. Baby heart rate is elevated. 30 to 60 is fine. 72 is high. Respiratory rate is elevated. And they have nasal flaring. Bad sign. The heart rate, 120, is fine. It can go to 110 too low. Look, 160 when they cry, 180, 125 is okay. And this temperature is not that bad. Therefore, what are we going to intervene? That one, nasal flaring. Those are bad signs. And nasal flaring, tachycardia indicates respiratory distress. A new nurse is assessing a client born at 43 weeks of gestation. Which of the following the nurse know the client is at risk of? Select or that apply. Same strategy. Break it down and tell yourself, I'm reading it from the back. Select or apply. I don't have to pick everything. Which of the following the know patient is at risk? That means risk factor. 42 weeks. What is the problem? 43 weeks, you are what? Post-term. Therefore, I'm looking for things about post-term. And what complication post-term lead to? Neonatal hyperglycemia, hypothermia, big baby, microsomia, meconium aspiration, fetal dysmaturity. What do you think? What do you think? If you grow in your mother womb for 43 weeks, you're going to chew all your glucose. Your glucose, all of them, will be gone. You're not going to have hyper. You're going to have hypoglycemia. You're going to get cold. The temperature is not going to be like that. You're going to get bigger. This is fine. You may poop and aspirate on yourself, meconium, and you're going to have this maturity. Therefore, CDE is the right answer. But this is concept I want you to mention. Master, when you see post-term baby, these are classic post-term baby features. And this is what you see. After 42 weeks, going to 40, after 40 weeks, getting to 42 weeks, microsomia, hypoglycemia, hypothermia, meconium aspiration, and fetal dysmotility. A nurse is assessing 12-hour-old newborn delivered at 30, what? 8 weeks to opiate-dependent mother. This is a hard one, and I will break it down for you. I got you. Which assessment? Finding the nurse expect irritability, high-pitched cry, very sleepy, hungry, and suckling vigorously. This 42 is the breaking point of our test. We are going 85, but this is our breaking point. There is a concept here. Look at the question. Let's break it down easily. Expected finding. What should I see? Baby was born 12 hours ago. The mother is 30 weeks when the baby was born, and mommy is opiate dependent. Write this down. If the mother is whatever they dependent on, when the baby is born, within 24 hours, the baby is going to do as if they're taking that medication. After 24 hours, they're going to withdraw from it. So within 24 hours, if you're taking what? Opiate? If you're taking opiate, the baby will look like they are taking opiate. That is the key. That is the key I want you to pay attention to. After 24 hours, they're going to be in withdrawal. So the kid is within 24 hours. Therefore, opiate is a downer. That means the symptoms should go down. Irritability is withdrawal. High pitch is withdrawal. Sleepy is intoxication. Suckling is withdrawal. And therefore, 3 is the right answer. You can see how this can be difficult, but this is the strategy. That's why I say the key is timing. Newborn will show intoxication symptoms within 24 hours of birth and withdrawal symptoms after 24 hours if their mother used any drug during pregnancy. And that's the concept I want you to master. A nurse is aware of several 3-hour newborn in a nursery. 3-hour-old. Which client in the nurse see first or should see first? This prioritization. So expected finding and unexpected finding. Baby was born at what? 40 weeks. What should I expect? Or they have testicles in their scrotum. Is okay. 38 weeks. He weigh 6 pounds in the head circumference is 33. It's 42 weeks. And there is the skin, desquamization of the feet, and absent venom. He has 37 weeks. 22 inches, and waxing substances about it. What do you think? This question is a little bit hard, but there's a problem. 40 weeks old, you're close to post-term, your testicles may be going down into your scrotum. This is fine. 38 weeks, weight 6 pounds is standard weight. This is okay. 42 weeks, baby is old, is the post-term. They have major problem. The cause is hypoglycemia. We saw the symptoms in the previous question. They have what? Microsomia. They may have meconium aspiration. The temperature may go down. Their glucose may go down. That is why you got to pick this. That is the concept. That's why I ask both questions for back to back. I pick those questions to teach you. D is right. This patient is problem. Is too old. And that's the signs and symptoms of that patient. And C, delivered at 42 weeks, desquamization of the feet and absent venom indicate post-term. They're more likely to have issues. That's the explanation for that. A newborn is born at term via what? Vaginal delivery. There's a reason why I say vaginal delivery. Baby born at vaginal delivery, there's a problem, things you have to know. Which action should the nurse take immediately after birth? The question is after birth. What should you prioritize after birth? That is the concept, after birth. Perform full physical assessment. Give the patient vitamin K so that they don't have infection in their eye. Dry the newborn. Place them on the mother's chest, right? Skin to skin. Weigh the newborn to assess their birth. What is the most important when the baby is delivered? Pick one for me. I know you got it because you watch adapting class. But what would you do? Physical exams is okay. The question is a prioritization question. Don't pick number one. Vitamin K injection usually is not done right away. You have within 24 hours. We have time. The word said immediately. That's the buzzword. Hypothermia is key. Therefore, this is our answer. That's the thing. Skin to skin to warm the baby up is much more important than doing a full neurological examination. Stop the video, answer the question like I said, and then try to go over the rest of the answer choice. This is also key. It's based on buzzword. What is the next priority? Underlying prioritization. That is the key. That's my key. Prioritization. A newborn assessment. During the newborn assessment, the nurse notes the following: intermittent cyanosis of the lips, not the skin of the hand, but lips. That is central. They have heart murmur, and their capillary refill is what? 4 seconds. That is a problem. What do you think? Place the newborn in the warmer and warm them up so that it gets skin will change in color. Notify the pediatrician and prepare for echocardiogram that you let the doctor know we got to do something about this. Apply oxygen to the client so that they get more oxygen and reassess them. Educate the parent about normal finding in baby circulation, newborn. What do you think? What is your answer? Put down your answer in the comment. Intermittent cyanosis, mama, and a refill, capillary refill of 4 seconds. This is congenital heart defect. You don't have to know the details, whether it is tetralogy or Foley. It does not matter, but that's the classic. Patient need more therapy, more treatment, more workup. Therefore, the right answer is going to be we letting the doctor know so that we can do further workup. Why the other answers are wrong is because you are assuming everything is fine. This is not, the cyanosis is central. It's not on the hands and feet. Therefore, warming them up is not going to help. The blood is coming from central. We got to do more work. Assessing for oxygen is not because they have oxygen. They have a heart problem. This is not normal finding. And these are signs and symptoms. Intermittent cyanosis, prolonged capillary refill, and harsh murmur is consistent with the tetralogy of Foley. What should the nurse do next? Another concept I want you to write down. Red reflex is key. NCLEX love. Asking them recently, people taking the test have told me that red reflex keep on showing up, and strabismus. This is one of them. red reflex. The nurse observed no reflex, red reflex in the left eye. What should you do? Repeat the test in 24 hours, notify the pediatrician, document the finding is normal at 48 hours, and explain to the parent that the test will be repeated during discharge. What do you think? This is the key. This is the key, right? Red reflex is not normal. So I'm telling you, if you don't have it, it's not normal. You're supposed to have it. A good red reflex means it's good. If you don't have it, means that you may have cancer in your eye, retinoblastoma. So we don't need to repeat the test. It's a warning sign. We should let the doctor know so that we can do further workup. This is not normal in the first 48 hours. After 48 hours, it's a problem. It's not normal in the first 48 hours. Therefore, this is never even normal. We're supposed to find something and work on it, because when it's not there, something is wrong. This is retinoblastoma. That is the key for that particular question. That is the key. So I know you get that one. Stay with me. And then assessing a newborn's Moro reflex, which finding is concerning. You know what Moro reflex is, right? Startle movement. A newborn cries loudly during the reflex. Do you expect the newborn to do that? A newborn exhibits asymmetrical movement of the hand. One hand moves, the other one do not. The newborn hand extend and return back. All of them go up and they came back. The reflex is absent after the newborn falls asleep. Think about it. Which answer choice would pick? I try not to make it so complicated. I try not to make it so complicated because I want to give you the concept, but test-taking strategy. Baby is asleep. There's no reflex. It's not going to be there. Cry loudly. When you're doing it, it's the startle movement. Therefore, it's okay. Now, 3 and 2 are saying the same thing, but in the opposite direction. One said both hands come together. The other one is asymmetrical. So they both cannot be right. Both cannot be right. And if I'm you, looking at the answer and using elimination, taking strategy, if both hands come back, we're good. If one doesn't come back, therefore, this is our right answer. You see, this may indicate a fracture or brachial plexus injury. This is how you answer questions when you